Hice from Georgia.
Thank you, Mr. Chairman. I just have really some comments here. I'm kind of just amazed, shocked at some of the things I've heard here today. You would literally think, in fact, it's been implied that ACA has somehow reduced cost and increased coverage. In fact, I believe I heard someone actually say something along the lines that we now have the lowest health care cost in our nation's history. I'm like trying to wrap my head around this kind of nonsense. Look, it's not the federal government's responsibility to take over the healthcare industry in the first place. And I'm as concerned as anyone with healthcare costs, but government intrusion is the problem, not the solution. And if Obamacare is as great as it is, I'm curious why none of our witnesses here participate. I mean, we all know that this is a disaster. And Mr. Chairman, what sets this hearing apart from other hearings on the ACA is that now we have a track record that we're able to look back on and see where this thing has been taking us. We have a track record to look at what the President and his administration originally told us versus what has come to fruition. Things like what's already come up today. If you like your health care, you can keep it. If you like your doctor, you can keep your doctor. We now have the track record to know that was totally false. And, you know, as we look at these kinds of things, we've got to face reality. Now we're facing the fourth enrollment period. And this whole thing is coming off the tracks. It is a national disaster. It's a healthcare disaster. It's an economic disaster. We've got Ms. Cohen, you mentioned 20 million people have been enrolled. You're including the Medicaid people. The real numbers are 12 million actual people enrolled in Obamacare, just over half of what was predicted. And all this contributes to the problem. I mean, many of you know firsthand, we've got insurers that are leaving. It wasn't long ago, United Health backed away. A couple of weeks ago, Aetna backed out. And why? Why are these insurers coming back? Because they're hemorrhaging in their costs. They cannot survive, despite the fact that billions of taxpayer dollars are subsidizing this thing. Insurance companies are still losing their shirts, and it can't continue. And for those insurance companies that remain, premiums going up and up and up and up and up just to cover the costs. This year, going up again in 2017, I think we're looking at a national average of 25% increase this year. My state of Georgia, we're expecting double-digit increases, more and more increases. Blue Cross Blue Shield going up over 20% in Georgia this year just to cover costs. And, you know, we talk about all these people, all these millions of people, Ms. Cohen, getting insurance coverage. Let's face reality. We have 20 million, perhaps, who think they have insurance. But in reality, and I've heard this, if I've heard it once, it's been dozens and dozens of times, particularly rural hospitals across my district. People go to the hospital thinking they have insurance, only to find out they've got $5, $10, $15, whatever, $1,000 of deductible. They can't even make the deductible payment. So the hospitals don't get paid. We've got rural hospitals on the verge of collapse because nobody's paying for what the coverage they're getting. And the problem goes up and up. This year, 65% of Americans are actually going to have the higher deductible option in this thing. This is not affordable for anybody. It's not affordable for our entire nation. And yet we have people continuing to try to defend it. I think it's clear to anyone watching and anyone experiencing this, which none of you are experiencing it because none of you participate. But people who are experiencing the horrors of Obamacare, they know what it's doing to their families. They know what it's doing to their health care options. And I think it's time, Mr. Chairman, that we get honest with this whole reality and face the facts that this is a disaster and we need to get rid of this thing and let the free market enterprise and individuals with their doctors determine what's best for them rather than government getting involved in this. And with that, I yield back.
I thank the